Hello, my name is Reagan Dunphy, and I believe that the Tarasoff ruling was not a step backwards, but instead a step forward in the evolution of the therapist-patient privilege. Tarasoff duty refers to the Supreme Court's decision that mental health professionals have a duty to protect individuals who are being threatened with bodily harm by one of their patients. After the unprecedented case of Tatiana Tarasoff's murder by Prasenjit Padar, it was a necessary next step for lawmakers and the court system to take in order to give direction for similar cases if they are to happen in the future. Prasenjit Padar killed Tatiana Tarasoff after she rejected his advances, and Padar's treating psychologist was aware of Padar's intent to harm Tarasoff in the time leading up to her murder. Even though I believe that this ruling is extremely necessary after the unfortunate and possibly preventable death of Tatiana Tarasoff, I can also see why the court decision is controversial. There are some extraneous factors that stem from the Tarasoff ruling that could lead to issues. One of these flawed factors is making the clinician judge the significance and severity of their client's threats, because whether it seems to be an innocent intrusive thought or the client actually intends to act on his threat is impossible to guess in certain cases. Another factor discussed is the lack of trust and confidentiality this creates between the clinician and their client. But I think that if the doctor is transparent about their duty to warn from the beginning, then this would not interfere with the doctor-patient relationship. Instead, I would ask those who disagree with the Tarasoff ruling to weigh the pros and cons of the possible outcomes. For example, if this ruling were to be overturned and hypothetically a person told their therapist they intended to harm someone and they went through with it, then what? Mental health professionals have a code of ethics to adhere to, and in ethical culture, you are obligated to be charitable with your resources and put others' welfare above your own. If a clinician was aware of possible physical harm being cast upon someone, then it would be unethical of them to not step in and try to prevent this from occurring. With that also comes the thought of appropriate treatment, which is characterized by using strategies which offer a reasonable promise of success, explaining risks and benefits to clients, and working to minimize harm. In order for a mental health professional to appropriately treat a patient who intends to harm another person, the clinician must work to minimize the harm the other person is in, and they must try to help their patients reasonably succeed by alerting executive forces to stop their patient before they do something so catastrophic. Overall, I believe that in a life or death situation like this, it is better to err on the side of caution rather than to put an innocent person's life at risk. Breaching doctor-patient confidentiality is very unethical in any other scenario, but in dire situations, it must be done.